And we're here to learn how to make the physical part of our fasting better in order to reap the maximum spiritual benefit, inshallah. So let's get straight to our first session. Our first speaker is Sister Doha Elbasha. She's a clinical pharmacist at the Queensland Children's Hospital, currently undertaking a residency program in pediatric specialties. Previously worked at the Townsville Hospital and has experience in community pharmacy, including rural areas. Sister Doha has been an IMA member since 2022 and an active community member and mentor to youth within the Sudanese community. Her topic is unsure how to manage your medications while fasting in Ramadan. You may be able to safely adjust the timing, which is very, very relevant to a GP such as me. Go for it, Sister Doha. Inshallah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Sister Noor, for the introduction. Let me start sharing my screen. Bismillah wa salatu wa salam ala Rasulullah. Thank you everyone for attending this session of Healthy Fast, Healthy Ramadan Talk, and thank you to IMR for inviting me to speak. We know that Ramadan is a very special time for us with lots of blessings and khair that comes with it, and we try to gain as much rewards as we can, inshallah. This evening, as it's been mentioned, I will be presenting on safe medication usage during Ramadan. The goal of my presentation is to support safe fasting while on medications. It's very important that prior to Ramadan, those who are taking regular medication should consult their healthcare providers to ensure their ability to fast and adjust their medications ahead of Ramadan starting. This is especially important for those with chronic conditions like diabetes, hypertension, asthma, and that sort of stuff. Now, before I begin, I would like to acknowledge the traditional custodians of the land of which we meet, the past, present, and emerging. We are very privileged to be living in such a country where we've got safety and water, food, and shelter, where some people don't, fortunately. So we are quite lucky, alhamdulillah. And just a quick disclaimer that this presentation is just to provide general advice and that you should always consult your doctor prior to making any changes. Just a quick overview of my presentation. I'll go through how pharmacists can support the community, the different medication route and forms available, medications that void or break the fast, adjusting the timing of your medication to align during non-fasting hours, and managing chronic conditions as well as specialty considerations. In the meantime, if you do have any questions, please feel free to write it down so that way I can answer them at a later stage to avoid interruption. The reason why I chose to discuss this topic of safe medication management during Ramadan is because many Muslims in our community live with chronic conditions requiring management of daily medications. These are often multiple medications taken multiple times of the day. And unfortunately, many people may stop taking their medication out of fear of missing out of Ramadan and out of fear of fasting, which then compromises their health. It is safe fasting is possible, but it's not for everyone. So it's important to plan thoroughly ahead of Ramadan. And it's important to maintain compliance with medications within Ramadan and even outside of Ramadan. And yeah, there are many cases where you can fast safely and cases where fasting is not permissible for you, and Allah knows best. Just a quick introduction leading on to Surah Al-Baqarah from Brother, an ayah from that surah, number 184, where Allah says, whoever among you is ill or on a journey, then they may make up the fast later. Bismillahir Rahmanir Rahim. فَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرٍ. Islam prioritizes health and flexibility for sure. If a person is ill and requires medication during the fasting hours, they're allowed to break their fast, and in such cases, they can make up the fast at a later stage, depending on their condition. Now, pharmacists are highly accessible healthcare providers within our community. But when we think of a pharmacist, the first thing we think about is a supply of medication. Yes, this is a big role of what we do, but however, we do a lot of things outside of supplying of medication. We work closely to ensure that medications are given safely and are stored safely as well. We collaborate with prescribers and other healthcare providers. We provide evidence-based practice and information. We do lots of education, counseling, and we answer questions to the general public as well as healthcare providers, like, does this medication break my fast? What do I do if I forget to take a medication? How can I change my medication to once daily? Or when is the best time to take this medication? Now, medications are given in multiple routes. When we think of a medication, we usually think of something that's swallowed, an oral tablet, or a suspension or a liquid, but there are so many other routes available out there. So we've got your oral routes as your liquids, capsules, tablets. You've got your sublingual, so those the ones that go under your tongue. You've got your buccal, they stick on the sides of your cheeks, intravenous, intramuscular, subcutaneous. So those are your injections. You've got your inhalers and puffers. We've got our transdermal, so those are your patches. We've got your topical or cutaneous, those are your creams, ointments, gels. We've got your rectal suppositories, you've got your vaginal, so those could be hormone replacement therapies. You've got intranasal nasal sprays, otic, so your eye drops and eardrops. You've got your medications given through the tubing, so nasogastric, PEG tube, J tubes, and then there's many other more. Kindly, Brother Omar came across this while we're doing research for this presentation. This is an article or a piece of paper that was published by Mufti Muhammad Zubair Butt. He is a Sharia advisor to the Muslim spiritual care provision, and he is also a BEMA member as well as a Muslim Council of Britain member. This page runs through very nicely what medications or what medication route can or cannot be given during Ramadan and what breaks your fast and what doesn't. It might be a bit blurry, but it has a lot of information in there. Now, to start off quickly, as I've mentioned, there's lots of medication routes available out there. So just wanted to highlight that when it comes to giving these medications, that some opinions vary between different scholars and schools of thought. So it's important to double check with your imams and scholars. But I have been referring quite a lot to Mufti Muhammad Zubair, whose research aligns with what the data that I have found. So generally, medication that do not involve ingesting it they don't break the fast. So if a medication doesn't enter your digestive tract, doesn't break the fast. Anything that enters the body through a nutritious route, that will break your fast, like oral medications. So that's your liquids, as we know, tablets, capsules, anything that's going into your mouth, sublingual, IV nutrition. So IV nutritional medications are those that provide nutrition. So that can be your glucose IV, your feeds. So those will break your fast. They provide hydration. So it's a way of you eating without physically putting something in your mouth. So those break your fast. Some injections don't break your fast. So your subcut injections, like your insulins, some IV injections and intramuscular injections, they would not, because they don't enter your digestive tract. So the PEG tube, nasogastric tube, and J tubes, they will break your fast. Inhalers are a bit of a gray area. Some scholars permit their use for medical necessities. Other scholars say that because they have little particles that reach the back of your throat, they are not to be used while fasting. Such as Mufti Muhammad Butt, he also advises against using inhalers while fasting. Again, opinions vary between using nasal sprays. So Nasal sprays generally they will break your fast because you can taste the medication coming down your throat and they enter your digestive system. So we advise against using those. And rectal suppositories or any medications given rectally, they enter your digestive tract through a different route. So they do avoid your fast. But overall, just wanted to point out that emergency care should always take priority. So if you are in need or if you are fasting and in need of your emergency medication, like if you are using a GTN sublingual spray, definitely do so and prioritize your health. If you are having a migraine and need to take an oral medication for that, you should definitely do that and make up your fast later, and Allah knows best. Um, So I just wanted to explain the difference between, I've mentioned in the past that in the slide that IV medications break your fast and that some don't break your fast. So classifying the two, the ones that break your fast and the ones that don't, it depends whether they're nutritional or non-nutritional. So medication that provide nutrition, so that's those who enter the digestive tract system, they will break your fast. So that is your PEG tubes, NG tubes, J tubes. Those are normally given for patients who cannot swallow medications. And then non-nutritive route is your some of your IV, intramuscular, transdermal subcuts. Those are usually given for they deliver medication to patients who have limited oral intake or are who have had severe traumas and cannot take anything orally. These don't provide nutrition and they bypass the gut. They go straight into your bloodstream. So these ones would be safe to use. And again, Mufti Muhammad also advises to use these if you are fasting, that they don't break your fast. Amazing. This is a comforting ayah for patients who have like chronic conditions or are in hospital. Again, from Surah Al-Baqarah, Bismillahir Rahmanir Rahim. La yukallifullahu nafsan illa wus'aha. Allah does not burden any soul beyond what it can bear. There are exemptions, and these are a mercy of Allah, where if you're unwell and need to take medication, then you can do so. Now, medications that don't break the fast, I've briefly touched on those earlier quickly, but we'll just run through them again. So injections, those non-nutritive IV, IM, subcuts, your eye drops and eardrops, they don't break your fast. Eye drops, they don't break your fast because they are not part of the digestive tract. They are from a different system. Sometimes when you instill an eye drop, you might feel the taste of it. That's fine to continue fasting. And then topical creams, ointments, gels, and patches, they are safe to use. And vaginal pessaries, they are also safe because they're not part of the digestive tract. And again, inhalers we advise against using those, although some scholars do advise that they are safe to use during fasting. But I'm just going to rule them out for now. And again, emergency medical care should always take priority when we're prioritizing our health. I came across this hadith by Sahih al-Bukhari. What if I forget to take a medication during fasting hours? Sometimes we get asked this question as pharmacists. So the hadith says if someone eats or drinks forgetfully, then he should complete his fast, for what he has eaten or drinken has been given to him by Allah. So Allah is most merciful. Then we have forgotten, we did not know. So continue with your fast as per this hadith. Timing of medication. This is quite a common question that we get as pharmacists. So you can change your medications to safely take them during non-fasting hours to ensure that you can still complete Ramadan safely. And it depends on what medication you're taking and the dose, how often it needs to be taken. So generally, medications that are taken once daily, we can alter them and change it so that way you take it at iftar time or suhoor time. Most of the time, if you are on a medication that's once daily, you might be taking it in the morning at breakfast or something. So with that medication, you can safely try to move it 2, 3 hours or so prior to suhoor, so prior to if the fasting beginning. So take it during suhoor time. Otherwise, if you take it in the afternoon, most people who take medications in the afternoon, they usually take it with dinner time. That's fine to do so. However, some people do take medications in the middle of the day. So if it's a once daily medication taken in the middle of the day, you can, depending on what the medication is, sometimes it needs to be slowly moved. Every few days, you can move it by 2, 3 hours to either before suhoor or after iftar time. Again, just speak with the doctor to make sure that it's safe to do so. Some medications you can straight away change from midday 12 o'clock dose to nighttime dosing without any consequences or side effects with that. So that's an easy one to do. The next option is medications that are taken twice a day. Ideally, we want to take them at iftar time or suhoor time. If a medication is BD twice daily, it doesn't necessarily mean that you have to take it 12 hours apart. So medications, they have a half-life and the pharmacokinetics, pharmacodynamics behind it doesn't necessarily mean you should take it 12 hours on the dot. They can be 8 hours apart. Some can even be 6 hours apart, depending on the medicine again. So for prescribers, I would suggest like looking into references like MIMS, which has pharmacokinetics, pharmacodynamic of a medication and the half-life that will kind of tell you what is a safe time between the first and the second dose. Otherwise, you can always reach out to a pharmacist that is available in your area. And so I've got an example here. We are having iftar at 6:30 p.m. and suhoor at 4:30 a.m. That is fine to take medications just at iftar time or suhoor time. No issues depending on the medicine. Generally, like antihypertensive could be safe 8 hours apart. And I've got a little note here, long fasting hours. So for some countries where you've got really long fasting hours or very short fasting hours, the short fasting hours makes it easy to take the medicine. But if it's a long fasting hours, again, having that 6 hour, 8 hour gap between the first and the second dose should be safe, depending on the medicine. And then 3 times a day medication. This is where it's quite important to go and see the doctor prior to Ramadan to see whether we can change that to an alternative medication where it can be taken once or twice a day. That's conducting pre-medication reviews. And other option is to see if there's a long-acting formulation available for this particular medicine or condition. So sometimes for some conditions, there are medications out there that work over 24-hour period where you take it once daily and it covers you through that period. Other times there's the twice a day medication. If unable to do so, then you will have to stick with the 3 times a day dosing. And I guess that would mean not being able to fast. Alternatively, if you live in an area where the fasting hours are short, you can take it at iftar time. Let's say iftar is 5 p.m. and then again 6 hours later, take the medication before bed, and then again in the morning at Fajr time, where you can take it if Fajr is around like 6, 7 a.m. That should be fine. But we don't have this luxury here in Queensland or in Australia, to say the least. The other thing to be mindful of, if you're changing these medication times during Ramadan, returning back to your normal timing after Ramadan is something to be mindful of as a prescriber and as a patient as well. You can continue with what you're doing, what you've been doing during Ramadan, or go back to your usual time, whichever's convenient. Again, going back to usual time, it's for some medications, you can't do a cold turkey, changing back to usual time. It might have to be slowly adjusting that timing by 2, 3 hours every day to get back to a suitable time for you. The other thing I wanted to stress the importance is double dosing. So if you forget to take the medication, your once daily medication, and the next day you remember, some medications you can skip out on for that the second dose. Don't double dose medicine. Just take off that one dose. Just take the one dose. And if it's a twice a day dosing, don't take 2 doses at once to make up that missed dose. Some of the long-acting formulations that we have available for prescribers to consider is some of the puffers. You can use a long-acting puffer for patients who are asthmatic. We've got those extended release or slow release tablets for oral or liquids. There's medications that come as once weekly, once monthly medications as well that we can look into to help with fasting. Um, Oral antibiotics, taking antibiotics to complete the course is very important. So ensuring that you follow the prescriber's instruction to reduce the risk of resistance, because if you are not taking your antibiotic properly, you are at risk of antibiotic resistance, where if you become quite ill, then we need to prescribe this antibiotic. It may not work for your body. So it's very important not to stop therapy until it's complete. And the timing of the medication depends on the medicine, the indication, and the severity of the condition. Some antibiotics are once daily, some are twice a day, but most of the times they are multiple times a day medication. In that case, you should continue taking your medication, look after your health, skip the fasting for those days, and make it up at a later time. Other antibiotics, so they're not just available in oral. We've got some topical antibiotics. Those are fine to use. There's some antibiotics, ointments, eye drops, eardrops. Those are fine to use. It's just the oral that we should continue taking it as prescribed. That will break your fast if you are taking it. Um, Anticoagulants are high risk medication and they should never be changed at home prior to speaking to your doctor. And that each patient is very individualized. So, getting that coagulation right is very important. So, for patients who take warfarin, to avoid INR fluctuation, take it at the same time each day and don't change the amount of green veggie consumptions during Ramadan. I know in Ramadan sometimes our diet changes a little bit, so just try to stick with what you've been doing every time. Other medications like rivaroxaban, which are taken once or twice a day, they can be taken at iftar if you're um, taking once daily. It's a bit more convenient. Otherwise, suhoor if that's what's preferred. I'm just keeping an eye on the time to make sure I'm not going over. Some medications are taken on an empty stomach because the absorption is advised to take on an empty stomach. The absorption is a lot better with that. And with these medications, there are multiple options and multiple ways we can do that. Obviously, in Ramadan, as soon as you break your fast, the first thing you want to do is eat, which makes it hard to fit that medication in. Usually, an empty stomach medication is best absorbed 30 minutes before food or 2 hours after food, which makes it a little bit difficult if you want to indulge all evening. A classic example is levothyroxine or thyroid medication. Um, this one here, the options I've listed, and I'll get you guys to think about to see what is the best option and what you would do if you are taking this medication. All of these options are safe. So the first option I've got is to take it in the morning, 30 minutes prior to suhoor. So you would wake up, do tahajjud, wake up straight away, have your medication with a glass of water, keep hydrated, pray your tahajjud, do your azkar, and then 30 minutes later or an hour later, you'll have your suhoor. That's another. Option two is to eat your iftar. Don't have anything for, don't eat anything for 2 hours. So you'll have a big iftar meal. Don't eat for 2 hours. Then take the levothyroxine dose. Wait another hour before having additional food. So this is not too bad. So you could eat, go pray taraweh, which might take 2 hours. Um, Take your medication. Don't eat anything for another hour. Yeah. And then finally, the third option is to have your medication at iftar. So basically, just have a cup of water and very minimal date, like 1 or 2 or 3 days as a sunnah. Then wait 30 minutes, 30 to 1 hour before having a full meal. So I have a auntie who loves the third option for her empty stomach medication. So everyone is different. So yeah, have a think and see what you would do if you were that person. Right. And again, with empty stomach medication or medication like levothyroxine, returning back to your standard hours after Ramadan is another thing to navigate. Right. So managing chronic conditions. So if a sick person is finding it challenging, yet it does not pose them harm, it's considered makruh or discouraged for them to fast. And it's sunnah and it's recommended for them to break their fast. However, if fasting is difficult and harmful, such as in the case of severe diabetes, it becomes haram or forbidden for them to fast. So diabetes, you've got the risk of hypoglycemia, which has lots of complication, and the worst thing is getting into a coma, dehydration, diabetic ketoacidosis. Some of the safer options that we can switch to is being on a long-acting insulin, being on a GLP-1 agonist, that's like your semaglutide Trulicities, and being on like a slow-release metformin or another anti-diabetic agent. It's very important if you're a diabetic to continue monitor your blood pressure, your blood sugar levels, and to see your GP for those bloods. It's quite important to have a stable diet and exercise. I know we'll be going through diet and exercise soon, so I won't go too much into details of that. Uh, and if you are making those changes, if we're changing a patient's insulin, their anti-diabetic, it's important to start this a few weeks or a few months prior to Ramadan to ensure that blood glucose level is stable when they start fasting. Hypertension is another condition that we see commonly in the community. Naturally, while you're fasting, your blood pressure will reduce anyway. So therefore, patients who have high blood pressure and while they're fasting, their blood pressure will go lower, which may mean that we have to adjust their antihypertensives anyway. So making sure that the patient has a home monitoring machine and that they're seeing their GP regularly to follow up and ensure that their blood pressure is within normal range. And dehydration can worsen the blood pressure. And noting that antidiuretics should not be taken at iftar. uh, Antidiuretics should be taken at iftar and not at suhoor because they can cause dehydration. So if you are on if you are on a diuretic, take it at iftar time so that way you can keep hydrated throughout the night instead of taking it in suhoor where you will be at risk of dehydration throughout the day. Most blood pressure medication are usually once daily, which can easily be navigated, or twice a day, which can again easily be navigated during fasting. If a patient is on a 3 times a day antihypertensive, which is very rare, then we can see whether we can optimize that and get them on a once daily or a twice a day medication so they can take it during non-fasting hours. Asthma is another condition that we see commonly in the community. It's important to ensure that the asthma is very well controlled and to maintain preventer therapy. So if patients who are asthmatic should, I think I was meant to say reliever therapy. Oh no, prevent. If a patient is asthmatic, to use their preventer prior to beginning the fast or at the end of the day at iftar time, and ensure that they have an up-to-date asthma action plan in the case of an emergency, and that noting that the inhalers used throughout fasting hours are not permissible, although opinions do differ. And gastrointestinal conditions are another common one, the GORD and the GERD. And we know that this can be worsened with meals, so important to maintain great lifestyle when you're eating, making sure that you're having small meals, nothing too greasy, which is hard to do, staying upright after having your food, not going to sleep straight away. And we know that most of the PPIs are usually once daily. Some patients are on twice a day PPI, which are also okay to do so. However, being on a once daily is better for compliance. Again, hydration and nutrition is very, very important throughout Ramadan, not even if you're not taking any medication, but especially important if you are taking medications, because some medications can be affected the amount of water in your system. So some medicines level can change while you're dehydrated or while you're overly hydrated. So just making sure that we are keeping our hydration right. Avoid caffeine as well, as we know that it can affect your hormones as well. So, and avoiding high rich foods. Some as prescribers, just be mindful that I've mentioned the dehydration with medication that can alter drug levels. So medications like antipsychotics, like lithium, some chemotherapy agents, and laxatives, diuretics, some of the diabetes meds can be affected by the level of hydration. So making sure we choose a medication that is less likely to be affected by dehydration is a great idea. Again, the Quran's Surah Al-Baqarah, ayah number 187. Allah says, Bismillah ar-Rahman ar-Rahim. وَكُلُوا وَاشْرَبُوا حَتَّى يَتَبَيَّنَ لَكُمُ الْأَبْيَضُ من الخيط الأزرق من الفجر ثم أتموا الصيام لليل. Allah says, this means like eating and drinking until the first light of true dawn. White thread appears on the horizon, break the fast on the darkness, then complete your fast till the nightfall, which is very beautiful. So, special cases where fasting is not permissible. So, we've got patients who are unable to fast, or family members who are unable to fast during Ramadan due to their health conditions. It's quite important to support these people because they might already be feeling guilty about the fact that they can't fast. So, being there for them and supporting them is really good. So, patients who have uncontrolled medical conditions or severe chronic conditions, like uncontrolled diabetes, is an example. Those who have acute illnesses that require medication. So, if you've got an infection that needs antibiotics and you can't take them during non-fasting hours, so it means that you'll have to break your fast. Conditions that require frequent hydration, antipsychotics might need that. Any medication that high risk of dehydration, or said that twice, high risk situations, frequent medication need. Yeah, that's about all. I also wanted to highlight the importance of mental health. So in our community, sometimes we don't speak about this very often, but patients who have mental health conditions, it's important that they are stabilized on the medication that they're on, and that it is sometimes hard to put them back to stability if we change their medication. So consider those, and they might be patients who could be exempt from fasting. Uh, so it's all about the prescriber who knows their patient quite well. And Allah, final ayah here that I've got, another from Surah Al-Baqarah, ayah number 18, where Allah says, Bismillah ar-Rahman ar-Rahim, يريد الله بكم اليسر ولا يريد بكم العسر. Allah intends ease for you and not hardship. So this is another beautiful and powerful ayah for comfort. It's reassuring patients who feel guilty about fasting and that they are exempt. We all want to make the most of Ramadan and obtain as much rewards as we can through this holy month, but sometimes it's hard. You can still obtain rewards through other ways if you are unable to fast. Just a quick summary of what I've gone through, that safe prescribing is possible and safe medication use is possible. Having to speak to your prescriber beforehand, making sure we alter those times to meet non-fasting hours is really important, and that you can always lean into a pharmacist if you need a hand for advice, or they can direct you as to where to find the resource or the reference or the data regarding this particular medication or condition, and just having open conversation as a patient with your doctors and imams and scholars around to be able to fast safely if you can. And now I have got quick questions to see how well you've been listening and how much you've absorbed. So I think there's a poll at the end, or you can just write down the answer. We'll go through it in the end. Very simple. Which of the following medication routes break the fast? When you are going through the answers, just write down why you think that is the case. And then next question, taking medication on an empty stomach, which is most appropriate and what would you do? I've got my references here, and then just ending on this fact sheet from Mufti Muhammad Zubair Butt, which kindly and very nicely summarizes the medications that break the fast and those that don't.
Jazakallah khair, sister. Obviously, it's a hot topic, so I let you off with a few extra minutes. But there was so many questions coming up. Inshallah, we can
Yeah,
address some of them under the Q&A. But I just wanted to ask you too, because it's while it's still hot, you might be able to answer it quickly.
yeah,
One of the question is, when is the best time to take supplements and vitamins? At iftar
yes.
or at suhoor?
Good timing. So, a good question. It depends on the supplement. So, if you're taking like your multivitamins, multivitamins. Otherwise, if you're taking your protein supplements, um, I would suggest it's best to take it at suhoor time. Um, Purely because you will be providing your body with so much nutrition at iftar time, and that the body just needs time to digest everything. So if you have a small meal at suhoor time, then take your supplements. That will be great. If it is like a protein, again, I think it would be best to take it at suhoor time because you will be filling your body with protein and basically filling your stomach to get you through the day.
No problem, sister.
Yeah.
And the second one you might have answered, but what would you recommend for patients with type 2 diabetes? Should they omit their metformin due to risk of hypoglycemia?
That's another good question. Depends. So if it's a slow release metformin, I would suggest to get the dose reduced. So instead of omitting the dose, speaking to the prescriber, if they're like on 1,000, like on 1 gram, they can go down to 500. And because a slow release means that it will be obviously over a 24-hour period. Otherwise, being on an immediate release tablet, I would highly recommend against that. So omitting the immediate release. Yeah.
No problem, sister. Jazakumullah khair. I'm going to leave the other questions for after because we still got more hot topics. And thank you so
Yeah.
much for a really
I hope I
wonderful.
didn't go over my time, but thank you so much for having me.
No problems, inshallah. But you have to stay for the Q&A because there's many
Definitely.
coming.
Inshallah.
All right.